Bloodborne disease is a type of infectious disease caused by bacteria or viruses that are spread through contact with infected blood. Illness results when the bacteria or viruses invade and multiply in the person's body. These pathogens can invade the body without causing disease if the body's immune system responds adequately. Only when the bacteria or virus overpower the immune system do the signs and symptoms of disease develop. Exposures to blood and other body fluids occur across a wide variety of occupations. Caregivers, healthcare workers, emergency response personnel, and other workers can be exposed to blood through needle stick and other sharps injuries, through mucous membrane contact, and through skin exposures. While there are numerous pathogens that can be spread through infected blood, including herpes, syphilis, and others, the pathogens of greatest concern are the human immunodeficiency virus, or HIV, the hepatitis B virus, and hepatitis C virus. During this video, we will discuss these bloodborne pathogens, as well as practices to prevent exposure to blood and other body fluids. Although HIV was first identified in 1983, studies of previously stored blood samples indicate that the virus entered the U.S. population sometime in the late 1970s. In the United States, over 900,000 cases of AIDS and 500,000 deaths among people with AIDS have been reported to the Centers for Disease Control and Prevention. Approximately 40,000 new HIV infections occur each year in the U.S. 70% of the infections among men, and the remaining 30% in women. Of the new infections, approximately 40% are from male-to-male contact, 30% from heterosexual contact, and 25% from injection drug use. The human immunodeficiency virus, or HIV, causes AIDS, which stands for Acquired Immunodeficiency Syndrome. When a person has AIDS, their immune system has been so damaged by HIV that they are no longer able to protect themselves against other infectious diseases. What makes HIV so uniquely dangerous is the way in which it attacks a person's immune system. The immune system is a system of specialized cells and organs that protect your body from outside organisms. When the immune system is working properly, it protects the body against bacteria and viral infections, even destroying cancer cells and foreign substances. If the immune system weakens, its ability to defend the body also weakens, allowing pathogens to grow and flourish in the body, eventually causing disease. A key component of your immune system are your white blood cells. White blood cells circulate throughout the body in your bloodstream, identifying and removing these foreign invaders. Untreated HIV disease is characterized by a gradual deterioration of immune function. Crucial white blood cells, called CD4 positive T cells, or also known as T4 cells, are disabled and killed during the course of infection. These cells, sometimes called T helper cells, play a central role in your immune system response, helping to identify invading organisms and signaling other blood cells to remove them. What makes HIV disease so powerful is that it destroys these crucial T4 cells, and as their levels deplete, the person's body is no longer able to defend itself against other infectious diseases. A healthy, uninfected person usually has T4 cell counts of 800 to 1200. During untreated HIV infection, the number of these cells in a person's blood progressively declines. When the count falls below 200, a person becomes particularly vulnerable to the opportunistic infections and cancers that typify AIDS. Most people will not have symptoms when they first become infected with HIV. They may, however, have flu-like illnesses within a month or two after exposure to the virus. This illness may include fever, headache, tiredness, and enlarged lymph nodes. These symptoms usually disappear within a week to a month and are often mistaken for those of another viral infection. During this period, people are very infectious, and HIV is present in large quantities in genital fluids. More persistent or severe symptoms may not appear for 10 years or more after HIV first enters the body in adults, or within 2 years in children born with HIV infection. This period of asymptomatic infection varies greatly in each individual. Some people may begin to have symptoms within a few months, while others may be symptom-free for more than 10 years. During this period, the virus slowly disables or destroys these cells without causing symptoms. However, as the immune system worsens, a variety of complications start to take over. For many, the first signs of infection are large lymph nodes or swollen glands that may be enlarged for more than 3 months. Other symptoms often experienced months to years before the onset of AIDS include lack of energy, weight loss, frequent fevers and sweats, persistent or frequent yeast infections that could be either oral or vaginal yeast infections, persistent skin rashes or flaky skin, pelvic inflammatory disease that does not respond to treatment, and possibly even short-term memory loss. Some people develop frequent and severe herpes infections that cause mouth, genital, or anal sores, or a painful nerve disease called shingles. The term AIDS applies to the most advanced stages of HIV infection. The CDC's definition of AIDS includes all HIV-infected people who have T4 cell counts below 200. In addition, the definition includes 26 clinical conditions that affect people with advanced HIV disease. Most of these conditions are opportunistic infections that generally do not affect healthy individuals. As you can imagine, as the disease progresses, the person becomes increasingly ill. Most persons are so debilitated by the symptoms of AIDS that they cannot hold a steady job or do household chores. Other persons with AIDS may experience phases of intense life-threatening illness, followed by phases in which they function normally. However, even with aggressive treatment, the disease will progress, and the person will eventually die from AIDS. HIV is spread by sexual contact with an infected person, by sharing needles and/or syringes with someone who is infected, or quite rarely through transfusions of infected blood or blood clotting factors. Babies born to HIV-infected women may become infected before or during birth, or through breastfeeding after birth. In healthcare settings, workers have been infected with HIV after being stuck with needles containing HIV-infected blood, or less frequently, after infected blood gets into a worker's open cut or a mucous membrane. Some people fear that HIV might be transmitted in other ways. However, no scientific evidence to support any of these fears has been found. Some ways that HIV is not transmitted in the environment, such as a public restroom or a toilet seat, in saliva, tears, or sweat. Although HIV has been found in saliva and tears in very low quantities, it is important to understand that finding a small amount of the virus does not mean that it can be transmitted by that body fluid. And insects. From the onset of the epidemic, there has been much concern about the transmission of virus by biting and blood-sucking insects. However, studies conducted by researchers at the CDC and elsewhere have shown no evidence of HIV transmission through insects. Hepatitis literally means an inflammation of the liver, and it is characterized by the following signs and symptoms: fatigue, malaise, joint aches, abdominal pain, vomiting, loss of appetite, dark urine, fever, enlargement of the liver, and jaundice. Most cases of acute hepatitis are caused by viruses. Hepatitis A is found in the stool of persons infected with the virus. It is usually spread from person to person by putting something in the mouth that has been contaminated with the stool of an infected person, such as contaminated food or water. Hepatitis A causes an acute form of hepatitis and does not have a chronic stage. The person's immune system quickly develops antibodies against hepatitis A, conferring immunity against any future infection. A vaccine is available that will prevent infection from hepatitis A for life. Hepatitis B infections result in an estimated 1 million deaths per year worldwide due to the complications of chronic hepatitis, cirrhosis, and liver cancer. Hepatitis B is a blood-borne pathogen that is transmitted when blood from an infected person enters the body of a person who is not infected. The virus is spread through having sex with an infected person, by sharing needles or syringes, through needle sticks or sharp exposures on the job, or from an infected mother to her baby during birth. In the United States, approximately 95% of persons infected with hepatitis are able to eliminate the virus from their body. However, about 5% of persons infected will go on to develop a chronic infection, and it is these persons who are at risk for long-term complications. Approximately 15 to 25% of chronically infected individuals will die because of chronic liver disease. A vaccine is available that will prevent infection from hepatitis B for life. Additionally, while at work in the facility, the use of universal and standard precautions prevents the transmission of hepatitis B from one person to another. The hepatitis B vaccine prevents hepatitis B disease and its serious consequences, such as liver cancer. The vaccine is given in a series of 3 injections over the course of several months. If your work involves the potential for contact with blood or other body fluids, your employer must offer the hepatitis B vaccine at no cost to you. While you are not required to have the vaccine, persons are encouraged to speak with their physician regarding any questions or concerns you might have. The hepatitis B vaccine is safe and effective in protecting you from the hepatitis B virus. Hepatitis C is also a blood-borne pathogen that can be transmitted through contact with infected blood. This includes through sexual contact, through sharing of needles or syringes, through needle sticks or sharp exposures, and possibly from infected mother to her baby during birth. Hepatitis C leads to chronic liver disease in approximately 70% of chronically infected individuals, with an estimated 1 to 5% of infected persons dying from chronic liver disease. Our best defense against viral hepatitis is through prevention. Additionally, persons who through their work may come in contact with blood or other body fluids should follow universal or standard precautions at all times. Standard precautions incorporate the major features of universal precautions and body substance isolation, and applies them to all clients receiving care, regardless of their diagnosis or presumed infectious status. Standard precautions apply to blood, all body fluids, secretions, and excretions except sweat, regardless of whether or not they contain visible blood, non-intact skin, and mucous membranes. Implementing standard precautions involves the use of workplace practices such as hand washing and the use of personal protective equipment such as gloves, masks, face shields, and gowns. Hand washing is the single most effective infection control practice you can utilize in the workplace. Wash your hands under the following conditions. After touching blood, body fluids, secretions, excretions, and contaminated items. Wash your hands immediately after gloves are removed, between client contacts, and when otherwise indicated to avoid transfer of microorganisms to other clients. While hand washing is a critical first and last step in standard precautions, it's also important to appropriately utilize personal protective equipment, the first of which would be gloves. You should wear gloves when touching blood, body fluids, and contaminated items. Put on clean gloves just before touching mucous membranes and non-intact skin. Remove gloves promptly after use, before touching any non-contaminated items or environmental services, and before going to another client. Finally, remember to wash your hands after removing and appropriately disposing of gloves. You should wear a mask, eye protection, or face shield and gown to protect the mucous membranes and skin during procedures or client care activities that are likely to generate splashes or sprays of blood, body fluids, secretions, and excretions. Depending on your workplace, this may not be a common occurrence, but these items should be available for your use when needed. Ensure that cleaning and disinfection of surfaces, beds, bedside equipment, and other frequently touched surfaces is being followed. Be cautious when handling or transporting linens. If linens are soiled with blood, body fluids, secretions, or excretions, the linens must be carefully handled wearing gloves and held away from the body. If the linens are particularly soiled, or it is difficult to hold them away from the body, a gown should be worn to protect the skin and clothing. The single most important thing to remember about standard precautions is that they are to be followed at all times. As we've learned in this video, persons can be infected with bloodborne pathogens such as HIV or viral hepatitis while showing no outward signs or symptoms. It is not possible for you to know if a person is infectious by simply looking at them. Standard precautions tell us that we should consider all persons we come in contact with, both clients and co-workers, as potentially infectious. This does not mean that we treat them as any less of an individual. It simply means that with every person we come in contact with, we are washing our hands, wearing gloves, and following the other key principles of standard precautions. While we never want you to be scared at work, it's important that you are aware of the potential for contact with bloodborne pathogens such as HIV and hepatitis. However, through the use of standard precautions, as well as common sense, you can protect yourself, your clients, and your coworkers. Much success to you in caring for your clients.